Hey everyone, welcome. This is Tulsi Desai, owner and founder of Active Body, Active Life Physical Therapy and Wellness. Dr. Noorhasan is a board certified reproductive endocrinologist and infertility specialist. And I am a huge fan of Dr. Noorhasan, so I really wanted to bring her on this page and help spread awareness of how skilled she is and how much she can help women suffering from infertility. Could you tell us a bit about yourself and how you decided you wanted to help women dealing with infertility and specialize in it?
Thank you, Tulsi, for that introduction. Just a little bit about myself. So I was born in Guyana in South America, and I grew up in the United States Virgin Islands. I was accepted to Boston University School of Medicine as part of their early medical school selection program. And after completing my medical doctorate degree, I pursued my obstetrics and gynecology residency at the University of Texas, Houston. And it's during my residency in obstetrics and gynecology that we rotated through the various departments where we got to take care of women, including our gynecological department, something you know quite a lot about, their oncology department, their high-risk obstetrics department, and my personal favorite, the reproductive endocrinology and infertility department. And when I did that rotation, I absolutely found my true calling in life. I knew I wanted to help women and generally all people have children. And so I pursued more training, a fellowship training in reproductive endocrinology and infertility at New Jersey Medical School. I've been in private practice now for about 11 years. The last 8 years has been here in the Dallas-Fort Worth area.
Oh, that's great. So that was how many years of education? That seems like forever.
Too long.
Yeah, no, I mean, it's a lot of hard work and dedication that requires to get to the point and to become a specialist to your level. So that's just commendable. Like, I don't think everybody can do it. So I think you have to have that passion to be able to go through all the ups and downs that you have to go through to get where you are and to be able to help women. So I think I am a medical professional, so I understand the terms endocrinology and reproductive endocrinology and infertility and oncology and all those things. But I think it can be very confusing for people who are not from medical profession. So could you simplify what reproductive endocrinology and infertility means? And then anything that you can help other people understand about what you do?
Absolutely. So endocrinology means the study of hormones. And because I do reproductive endocrinology, it's hormones of the endocrine system related to reproduction, essentially. So we're very specific about which hormones we study. And because we look at those hormones related to the reproductive system, we learn how those hormones change when a woman ovulates, when she conceives, throughout pregnancy, and how her body returns to normal after delivery. And because by understanding how the woman's body works, we're now able to manipulate that system, the reproductive endocrinology system, to help women conceive who otherwise would have troubles conceiving.
Mm-hmm. I think that makes sense. And if you have to help somebody understand whether they have infertility or not, is it just that they need to wait to see if they can conceive, or is it that they actually might have infertility? How would you explain infertility? What is infertility?
So the absolute definition of infertility is when a woman less than 35 years of age has been trying for a year or longer to conceive without conception, then that she meets the definition for infertility. And if that woman is age 35 or older, then it's 6 months of trying to conceive without conception. Now, there are many people that need to see a fertility doctor without waiting that 6 to 12 months. Those would be someone who doesn't ovulate, someone who has problems with multiple or with even just one endocrine system in their body where they're going to need help with that working. And then members of the LGBTQ population certainly need our help. And then also I have single women and single men who want to conceive. So not everyone has to wait 6 to 12 months. And there are also, I get lots of patients sometimes that will come through and they just want testing. They just want to know, is everything okay with my system? And that's all they want to know. And sometimes I hear from them a few months later, a few years later, and they've had a baby. And sometimes they come back in a couple months or a few years and say, now we really are ready to have a child. But it's nice having that testing done initially so they at least have the knowledge to help them make decisions if they want to pursue pregnancy immediately or if they want to wait a little while to pursue pregnancy.
How long, in your experience, do people wait before they even consider consulting a specialist? Are they getting enough guidance from their gynecologist on time, or are they not even seeking help in the first place and it's too late for them to try anything? Just some idea for people who might be suspecting that they may need help, but they're just not sure. Should they just wait it out?
In the past, we used to see people who waited a long time before coming to see us, but thank goodness now there's a lot more fertility awareness. 1 in 8 people struggle to have a child. And because fertility awareness is more prevalent now, we're all talking about it. We all know a friend or multiple friends or family members who are struggling with it. Because the awareness is out now, I'm seeing people coming in early. They know there may be something that's wrong with them and they want the testing at least just to find out. So I'm grateful that we're talking about it now more frequently than we did in the past.
Yeah. And I think there is less stigma attached as compared to maybe 15, 20 years ago, because I can definitely see within my patient population that people are talking about it more freely. But I have still heard about stories where I would have to encourage my patient to tell their relatives, just have them call somebody, like just go explore your option and not wait for the right time, because you're losing time, especially after a certain age for women. So I think we can go into the treatment aspect later on, but what causes infertility? What are the most common causes, and what are maybe some symptoms where people can kind of associate that if somebody has this kind of symptoms, they may have some hormonal imbalance that could lead to infertility? If you can give some tips there.
Mm-hmm. So the most common reason that I see patients coming in for fertility is advanced reproductive age. And so for us women, we're born with all the eggs we will ever have, and then we lose them with time. And we start to lose them in our early 30s, and then a steeper decline in our mid 30s, and a much steeper decline in our late 30s, and even steeper decline in our early 40s. And then at some point I'm having to do another egg talk. So the most common reason I see for infertility is age-related decline in egg, but also age-related decline in sperm. Men are a little bit luckier than women are in that they make new sperm every day. However, there is some age-related decline. It may not be as early or as young as it is in women, but we do see that in older men too. So to answer your question, the most common cause is age-related decline. And our society has changed. 50 years ago, people got married in their early 20s and started having children. Today, we are pursuing our careers. We're traveling the world. There's so many things that we want to do. And then, by the time you blink, you're a whole lot older, and it's now more difficult to conceive. And I personally know that. As you mentioned earlier on, I spent a long time in school and I forgot to meet Mr. Right. And the next thing I knew, I was in my very late 30s and really struggling. So I too have personally undergone fertility treatments. So the most common cause for age-related, then other causes. So certainly there's male factor, and there are things that we look at in a semen analysis. So things like the count or the quantity of sperm. And then we look at the motility, how fast the sperm moves, and then the shape of the sperm. So those are some of the bigger parameters that we look at. Another cause of infertility is a tubal factor. Essentially, the fallopian tubes don't work like they should. And there are multiple causes. Prior surgeries, which can lead to scar tissue, something you're quite familiar with. And then endometriosis can also lead to scar tissue, pelvic pain, previous infections. So there's numerous causes of tubal-related factor. And of course, also there are previous tubal ligations. You know, sometimes people get married early, have one set of children, think they're done, and you know, they get divorced, and then you know, get married again later on and want to have children with their new partner. So there's certainly tubal factor. And our society has changed, you know, drastically in the last 50 years. There's certainly a component to things we may be exposed to, or eating habits, or lifestyle has certainly changed than it was 50 years ago. So certainly there's a component of that. And so I'd say about a third of the causes are female, a third male, and then a third both. And then there's a fairly large percentage of causes of infertility where it's unexplained. So unexplained means I would do all the testing and all the testing is normal. And those patients also need help conceiving. So everyone should get tested if they feel like they're struggling with fertility. There are not too many true symptoms of infertility. The one thing that you know, will lead a woman to come in fairly early on is if her cycles are irregular. Usually, if a woman has fairly irregular cycles and it's very unpredictable, there's a good chance that she's not ovulating regularly. And if you're not ovulating regularly or releasing an egg on a regular basis, then there's no egg to be presented to the sperm, and then that decreases your chances of fertility. So that's probably the only one where there's a true symptom, but most of the times there's no symptom that you can measure that would lead you to go in and get evaluated.
That's very helpful. So if somebody comes in, I think most people understand when there is an age-related factor. If somebody is 35, 38, 39, by that time, they have better awareness than when someone is in their 20s, because I think everybody in their 20s think they're healthy, everything is fine with them, they can conquer the world. Like, nobody's expecting that there would be something wrong with them. So when they are struggling with infertility, what are major reasons for somebody in their early 20s coming to you for infertility?
Yeah, the usual big reasons are tubal factor, so the tubes don't work well, severe male factor, and then not ovulating. So when there's not really an age-related cause, those are the three big things that I'll notice in testing.
Okay. And I think I will ask you one last question, and then we will continue this next week again, and we'll go more into treatment part and any other details. I think it will also give people a chance to ask some questions under this thread, and we can maybe address that at that time. So I have had a lot of patients, when I take their history, they tell me that they have been on birth control pills since they started having menstruation, because they just had irregular menstruation or periods, or they had some other things going on, or they had acne and a lot of hormonal imbalance, and the gynecologist put them on a birth control pill. So when they have been on a pill for such a long time, they don't even know if they're going to get if their periods were regular or not for this many years. So is that something that goes in terms of, for you to help them? Is that a barrier, or is that a helpful factor? What are your thoughts on that?
So that's a very good question. And each patient is so different. So some women with irregular cycles, they go on birth control pills, and they come off the birth control pills and they resume what they used to be, irregular cycles. Some women will go on birth control pills and come off, and now they're regular, and they get pregnant within the first few months of coming off of birth control pills. And then other women who used to be regular go on birth control pills and then come off trying to get pregnant, and now their cycles are irregular.
Right.
So it's quite variable from person to person. And what really happens is our body changes over time. And by being a birth control pill, it's masking what that change would have naturally have been. So you don't know that your body's truly changing or your reproductive system is truly changing. And only by coming off the birth control pills, we are now removing the mask, and now we can see what changes actually happened while you were on birth control pills. So certainly if someone came off of birth control pills and they tried, for 6 months, someone who's, more than 35, should certainly come in. If they tried for 3 to 6 months and they used to have irregular cycles, they resume their usual irregular patterns, they probably are going to need help. So they should just come in as soon as possible. They can contact us. My office number is 972-377-2625. And you can look me up. I'm on Facebook, Instagram, Twitter.
I'll tag you.
You'll tag me. So there's certainly ways to look me up. There are ways to find out about my own personal story in my book. That's www.noorhasan, NOORHASAN.com.
Yeah.
So there's multiple ways that people can reach me.
I think we should start next session with your story. I think that's really inspiring and people need to know it. So maybe we'll start there and then we'll go into treatment part.
Absolutely. I look forward to it, and I look forward to hearing from everyone. Your comments, your questions. Let's answer all of them next week.
Yeah. Thank you so much for joining us.